Unveiling the hidden threat, antimicrobial resistance in asymptomatic Salmonella carriers. Introduction. Antibiotic-resistant Salmonella carriers without symptoms are a significant yet often overlooked danger to public health. This study delves into the intricate world of antimicrobial resistance, AMR, in Salmonella, isolated from seemingly healthy workers in Yulin, China, over a 12-year period, 2013 to 2024. The primary objective was to characterize AMR patterns and identify the natural and socioeconomic factors that influence this growing concern. Methods. The study employed a comprehensive approach, testing antimicrobial susceptibility against 11 agents. Temporal trends in AMR rates were analyzed using the Mann-Kendall test, while associations with natural and socioeconomic variables were assessed through Spearman's rank correlation, principal component regression, PCR, and least absolute shrinkage and selection operator, LASSO, regression. An autoregressive integrated moving average (ARIMA) model was utilized to predict future resistance trends. Results. The findings revealed a concerning prevalence of tetracycline (TT) resistance, with a mean rate of 66.2%. Multidrug-resistance (MDR) was also alarmingly high at 41.9% and showed a significant increasing trend, p less than 0.05. Most strikingly, tigecycline (TGC) resistance surged from 0% to 24.4% by 2024. The PCR model identified a socioeconomic and healthcare development index as the primary predictor of this increase, explaining 54.9% of the variance in TGC resistance rates. The ARIMA model predicted a continued rise in TGC resistance through 2025 to 2026. Conclusion. This study highlights a significant rise in MDR Salmonella among asymptomatic workers, positioning them as crucial reservoirs of antibiotic-resistant Salmonella. The emergence and rapid increase in TGC resistance are strongly linked to regional socioeconomic and healthcare development. These findings emphasize the urgent need for integrated surveillance within the One Health framework to combat AMR transmission effectively. But here's where it gets controversial. The study's results suggest that socioeconomic factors, such as healthcare infrastructure and economic growth, play a pivotal role in the rise of TGC resistance. But is it ethical to attribute healthcare development to the emergence of resistant strains? Shouldn't improved healthcare lead to better infection control and reduced resistance? These questions spark debates about the complex interplay between healthcare advancement and AMR. Controversy aside, the implications are profound. The study underscores the importance of considering asymptomatic carriers in AMR surveillance, especially among food workers. The One Health framework, which recognizes the interconnectedness of human, animal, and environmental health, is crucial in understanding and addressing AMR. However, the specific influence of macro-level factors on long-term AMR trends remains a puzzle, particularly within asymptomatic populations. A call for action. The study calls for enhanced surveillance strategies that target asymptomatic carriers and silent transmission pathways. By integrating environmental and socioeconomic data, evidence-based interventions can be designed to curb AMR transmission within the One Health paradigm. This includes implementing stricter regulations on antibiotic use in agriculture and healthcare, improving sanitation practices, and educating the public about the risks associated with asymptomatic carriage. But the story doesn't end here. The study's findings also raise questions about the impact of global warming on AMR. As temperatures rise, the frequency of horizontal gene transfer, HGT, increases, facilitating the spread of resistance genes. This connection demands further investigation to fully comprehend the implications of climate change on AMR dynamics. A complex web. The relationship between socioeconomic factors and AMR is intricate. While the study suggests a strong association between the socioeconomic and healthcare development index and TGC resistance, it also highlights the importance of considering multiple factors. The LASSO regression, for instance, penalized all individual factor coefficients to 0, indicating that no single variable independently predicted resistance when accounting for multicollinearity. A call for further exploration. The study's limitations, such as its regional focus and lack of genomic analyses, emphasize the need for broader research. Future investigations should incorporate genomic surveillance to trace resistance genes and transmission pathways at the molecular level, providing a more comprehensive understanding of AMR dynamics. In conclusion, this 12-year surveillance study underscores the growing threat of AMR salmonella in asymptomatic carriers, characterized by increasing MDR rates and emerging TGC resistance. The findings highlight the complex interplay between natural and socioeconomic factors in shaping AMR patterns. To effectively address this challenge, integrated surveillance and management strategies are imperative, focusing on asymptomatic carriage and silent transmission within the One Health framework.